called the Copenhagen Plank. It works your hip adductors, those groin muscles, and you want to think of four sides of your hip: the inside, the front side, which is your hip flexors; the outside, that your hip abductors, your glute medius; and then the back side that everyone knows, glute max. You want to have all four sides of your hip to be nice and stable, because your hip is part of your core, right? And you want that to be nice and strong to keep your pelvis nice and strong. So this exercise, you're going to use a chair or a bench, and then you're going to straddle it and then get into a side plank position with your shoulders stacked over your elbow. And you're going to try and hold this position. My knees are trying to squeeze together. I'm not letting the bottom leg get lazy. I'm holding this position, not letting my hip dip down. And then when you can hold this position for at least 30 seconds to a minute, that's a sign that you should be able to progress and move further away. But one thing to keep in mind, that if you've had a knee injury, this is kind of a vulnerable position to put it in. So if there is some kind of pain or discomfort, just go back to the first position. So this is what it'll look like. This is pretty challenging for me, so bear with me. You're going to get up into that side plank position, really squeeze your feet together, not letting the bottom leg go down, and hold it for an amount of time that feels challenging and your form isn't failing, and really feel those groin muscles working.